Assalamu alaikum. Elbow dislocation. It is a very important topic because the elbow dislocation is the second most common dislocation after shoulder in adults. But in pediatrics, elbow dislocation is the most common joint to be dislocated. Of course, posterolateral is the most common type of dislocation, around 80%. Mechanism of injury of elbow dislocation. باش يصير الelbow dislocation, the forearm should be supinated. So the head will be rotated in this direction in supination. بعد يصير supination of the radial head. It will go a little bit backwards. يعني تقريبا تبي تقعد هنا. الهيد اوف radius ما يوخرش بروحه، ياخذ مع الأوليكرينون because they are in a direct contact through the radial notch. معناته في الحالة هذه الهيد اوف radius والأوليكرينون موجودات في level posterior to the distal humerus. بالإضافة أن الديستال humerus تكون فيها anterior tilt حوالي 30 درجة، خذيناها في البايوميكانكس of the elbow. بعد يجي axial loading plus posterolateral valgus force والforearm supinated، يبدأ يصير dislocation. معناها العامل الرئيسي لحدوث الديسلوكيشن هو supinated forearm. نفس الميكانيزم هذه كان صار axial loading with posterolateral valgus force and the forearm not fully supinated، يصير terrible triad. معناها المين difference between the mechanism of injury leading to elbow dislocation and mechanism of injury leading to terrible triad is supination of the forearm. In terrible triad there is no supination of the head of radius. معناها الراديوس متوخرش لورا، ما زالت قاعدة قدام، حتى الأوليكرونون ما زال قاعد في نفس الارتيكولار سيرفيس with the distal humerus. بعد يجي الأكزيال لود plus valgus force posterolateral valgus force، يصير shear fracture of the coronoid first, then fracture of the head of radius, then dislocation of the elbow. هو هذا terrible triad. تمام، هيك واضحة الميكانيزم of injury. The main factor for elbow dislocation to occur is supination of the head of radius. When it's supinate, it will go behind the coronoid and it will dislocate without any fracture. Simple dislocation. مهم نعرفوا أيضا أن pronation and supination movement of the forearm، في الموفمنت هذه المسؤول عنها هو الراديوس only not the ulna. الألنا تكون stable ما تتحركش، يتحرك هو الراديوس. شوف هنا الألنا stable، هذه الحركة البرونيشن. البرونيشن يصير crossing of radius، يدير crossing للألنا، بعدها هيك يرد يقعد supination، هيك pronation وهيك supination. في البرونيشن الراديوس يدير كروسنج للألنا anteriorly، ويدير في روتيشن ويدير كروسنج للألنا anteriorly، عشان هيك يصير له translation a little bit anteriorly but in supination it goes backward. مهم أني نعرف أن في الباثو anatomy there is circular disruption of ligament stabilizers and capsule, and there is a pathognomonic cascade. It's very important to know this cascade. They suggest that the lateral collateral ligament avulsed first, not the medial. And this is very important. The first ligament to fail is the lateral collateral ligament. أحداث تصير كالتالي: يصير posterolateral valgus force, then lateral collateral ligament first to be injured, then elbow dislocation, then medial collateral ligament. So the first to fail is lateral collateral ligament and the last to fail is medial collateral ligament. معناها النتيجة هنا يكون عندي dislocation medial collateral and lateral collateral ligament injury. So what are the stabilizers of the elbow? The elbow has static stabilizers which include ligaments, bone, and capsule. And the static stabilizers divided according to their importance into primary static and secondary static. Primary statics are ulnohumeral joint, anterior bundle of medial collateral ligament, and lateral collateral ligament complex. Secondary static stabilizers are radiocapitellar joint, capsule, and origin of flexors and extensors of the forearm. The dynamic stabilizers are the muscles which crosses the elbow and causing compression force. These muscles are anconeus, brachialis, and triceps. Dynamic stabilizers هذه تلعب دور مهم جدا في conservative treatment of simple dislocation of the elbow after you reduce the elbow, and we know there is ligamentous injury on the medial collateral and lateral collateral ligament. So after you reduce the fracture, the dynamic stabilizers will keep the joint articular surfaces in place, will keep the joint congruent until healing of the static stabilizers occurring. من اللي يلعب دور هذا؟ dynamic stabilizers. Elbow dislocation classified as anatomically into posterolateral and posteromedial كيف according to location of the olecranon relative to the humerus. If the olecranon is found laterally, it is called posterolateral, medially posteromedial. And of course, posterolateral is the most common type of dislocation. And another classification which help us in treatment, it classifies the elbow into simple or complex. Simple, that means no fractures. So there is dislocation, there is medial collateral ligament and lateral collateral ligament damage, but there is no fractures. And the second type is called complex elbow dislocation. Complex dislocation means there is a fracture which may take the form of terrible triad injury in which there is dislocation, ulnar collateral ligament injury, plus fracture of tip of the coronoid, which means type 1 coronoid fracture, and radial head fracture. So terrible triad is dislocation with lateral ulnar collateral ligament, type 1 coronoid fracture, and radial head fracture. And there is another type of complex elbow dislocation which is less common than terrible triad. It is called Varus posteromedial rotatory instability, in which the medial facet of the coronoid is fractured. So there is dislocation with medial facet of the coronoid fracture. This classification is very important because it guides us in treating the patient with elbow dislocation. Regarding the clinical presentation, please don't forget to assess shoulder and wrist, because fall down on outstretched hand may lead also to injury of the wrist or shoulder. Of course, neurovascular assessment are very important. After you see a patient with deformity of the elbow and history of fall down on outstretched hand, then you have to ask for X-ray, AP and lateral. Most commonly, you will see the head of radius is displaced laterally in AP view and posteriorly in lateral view. So this type is posterolateral type, which is the most common type of elbow dislocation. There is no fracture, so this type of fracture is simple posterolateral elbow dislocation. You have to do CT scan to assess the articular surface and periarticular fractures. How to manage elbow dislocation?